So, good evening. You're watching Mental Health Awareness. I'm Timothy Wright, along with my cousin Quintera, Michelle, and Ebony. Before we get started, if you are watching from Facebook, like and share. And then if you're watching from YouTube, subscribe to our YouTube channel so you will get the notification every time we go live. Again, this is Mental Health Awareness. We want to uh, answer some questions from our last segment. So, but first, let's do this. Michelle, how are you?
I'm absolutely great on tonight. I'm glad to be back. I look forward to our talks but I'm doing well.
Wonderful, wonderful. Miss Ebony,
Hi, everybody. I'm doing great. I'm glad to be back. And, I'm glad you guys were able to enjoy the last show. And we look forward to getting into the questions you had. And it's going to be a great night.
Quintera.
Hey guys, as always, I absolutely love talking about all things mental health. It's always a pleasure and a joy when we get together, kind of talk about things and laugh and joke, and then bring up anything else that we may have heard through social media or things that we're learning, hot news, different subjects of matter. But I'm just super happy that, the last podcast went really well and that it was super informative for a lot of families and a lot of individuals. And as always, we're prayerful that this information is as helpful as possible.
All right. So, the last time we were on, we were talking about opioids and fentanyl, which is synthetic of opioids. So we kind of want to recap, ladies, if you could help us to recap on pretty much what we talked about last time we were on. And then we'll go into our questions. I think the questions are enough for us to have enough to talk about. So let's kind of do a recap.
Sure. We talked about opioids last week, and it's pretty much a synthetic drug that turns off your opioids receptor. So basically, there's a receptor in a chemical receptor that basically tells you that this is a feel good med. You know, I take this med and I feel good. So a lot of individuals abuse the drugs because of the simple fact that they're no longer in pain and it makes them feel good. So, who wants to be in pain, right? Nobody. So, they'd rather take the drug, even if they abuse the drug and taking it excessively or more than what they should. So, that's the simplicity of kind of how a lot of people get addicted to these different type of medications because it sends off a signal to your brain to make you say or make you think like, I'm feeling better.
All right.
And
Anybody?
yeah, we also discussed the epidemic that's going on now with the fentanyl that's being laced into the marijuana. And sometimes, people are smoking marijuana or doing different drugs that they think is quote unquote safe, but it's also being laced with this fentanyl and it's causing severe damage, whether there was some deaths involved. There's a lot of psychosis that becomes related with it. People are kind of like, it, checking out pretty much, so it's basically like it's messing with their mental state. There's been a few people who were in a coma, so it's doing a lot of damage. So we was talking about that as well, and being mindful that they're actually trying to there's like this cartel, they're trying to push this fentanyl and expose our children to it through candy and things like that, where they're getting addicted and not even knowing that they're taking something that's so harmful.
Absolutely. Michelle?
And also research the CDC and anyone can look up this research, but CDC says that fentanyl is the number one cause of overdose and cause of energy, opioids. I'm sorry, not fentanyl, but opioids are the leading deaths in the United States. And ever since COVID, the pandemic, it actually has increased. It's accelerated. And it's just important that we have these talks and communicate to kind of improve and kind of intervene to help our children from dying, and help people from dying. Education and talking and communication is the way to improve the outcomes.
Right. So we also talk about the fact that how potent this drug is as well, where it can be 50 times more potent than heroin and 100 times more potent than morphine. That's crazy. So we just want to inform people, especially parents, what's going on, and we just want to answer the questions that we have that you have put before us to the best of our ability. So, do we need to get into the Q&A now?
Sure.
All right. So the first question was, does fentanyl comes in a patch formula?
It does. Actually, fentanyl comes in many different forms, but patch is definitely a different form. However, it is not highly recommended, and then also is not actually given often. You have to get it from a PCP. A lot of individuals who does take a patch form of what could be included, one of the opioids that could be included is fentanyl, is very limited. And there are generic brands as well as name brand patches that you can use. However, it's for individuals who have extreme chronic pain. And so a lot of these different things can happen from car crashes. Individuals with cancer, may have a rare disease. But a lot of times, all other medications are exhausted first. Like your body becomes immune to certain medication over a period of time, but all other methods of medications are prescribed to you first before even giving you a patch. But there are patches out there, but it's for individuals who have the most chronic pain. And like we said before, it is like an addictive drug. It gives you that feel good receptor. So like if you don't need it, you don't have to have it. And usually individuals who take these patches, you put it on your body, so it's intraderma. So you put it on your body and it usually lasts about 5 to 7 days. And so you take it off and you do it again. So it's like a cycle. But I say if you don't need it, don't use it. But chronic pain it's painful. Like you've never been in a situation where you just like cannot deal or tolerate with the pain anymore. There's individuals who say, I'll do anything to get rid of this pain. So for those individuals, then you can look into other resources. I think medication is good for you. I'm not going to say medication is bad. I think how we use the medication, if we abuse the medication, then it becomes bad.
Now, I think a lot of times we don't understand the mental effect as well with some of the stuff. And I think one thing we need to stress too is the mental side of it as well.
Oh, for sure. Like just think about the fact that I don't know, I've always had migraines. Like, I am a victim of migraines and I've had them almost all of my life. And chronic migraines, to the point where I was on medication for migraines. But it is very debilitating. And it limits you, from light to sound, not wanting to be around people, and it's painful. It is a painful feeling to get a migraine because a migraine can last for an hour, a migraine can last for 3 days, a migraine can last for 2 weeks. So imagine just being in a state of pain that there's nothing you can take to make you feel better.
Right.
Anybody else? I agree. Yeah, I was going to say I agree because I also suffer from migraines and it is absolutely horrible, So one thing that kind of worked for me, I kind of learned how it's triggered and when it's starting. So what I would try to do is like with me, it usually starts as like a small headache. So once I know if maybe I didn't eat that day or something, I try to kind of remedy it in the beginning before it gets so bad to where I have to take these these stronger medications. So yeah, definitely. You're right, Q. Like it's like no one wants to be in pain, but sometimes there's there's no avoiding taking these hard medications, but just be mindful that they do have an effect on you. And especially sometimes it does become, where you become more dependent on it than you actually need it.
Absolutely. Okay.
And I know, just to piggyback of working in a mental hospital and working with clients that come in to detox from opioids, and heroin and crack cocaine, and of course pills. One of the assessments I asked them in the questionnaire, I asked them, well, when did you first start using? And most of them started using, you know, due to an accident. Something happened that caused them pain. I think I can say about over 90% of people that I've interviewed have said the same thing. It first started when I was in a car accident or a football injury or swim injury, or I hurt my ankle and they gave me pain relievers, and it went from there. So as Q said, no one wants to be in pain. As Ebony said, she's proactive. When she feels the headache coming on, she goes ahead. She normally I'm going to sleep, I'm going to lay down. But think about when you can't be proactive. When you my son was in a car accident and he broke his femur, right? So they gave him pills. I was like, we got to try to find something else because you're not getting it. Keep popping these pills like you popping them, right? But that's a legitimate accident, you know. So yeah, that's how it starts. They're prescribed to manage pain.
So it's start from a prescription to an addiction.
Right. And that's kind of what we were saying on last week too, is that, you know, a lot of times when people think of opioids, and especially when you think about fentanyl, it is a prescription drug. So a lot of people don't think about this as like a hard street illicit drug, right? You got marijuana, you got heroin, you got, all crack, cocaine, you got everything, right? That's out here in the streets. But when you think about, when you think about fentanyl, when you think about opioids, these are prescription drugs that are given to you by a primary care physician or, a nurse practitioner. And so a lot of times people, they take these drugs thinking like, oh, it's okay. Like I got this from my doctor, but when you start depending on the drugs and you're taking drugs more than what's prescribed to you, right? So say you take a drug like it's prescribed to you, take as needed. Some people say, okay, I'm gonna take this 3-4 times throughout the day, and you're only supposed to take at least 2 a day, And so a lot of times it is used out of context, or people misrepresenting the medication, misinterpreting the way to take the medication, because at the time, all they're trying to do is just fix the pain,
Let me ask you this: so you're suggesting that most of the overdose with opioids are in a sense unintentional?
For sure, and you can find fentanyl's in a lot of different drugs. Like, you know what I mean? And so some of the most common drugs that you can take from fentanyl is like oxycodone, Vicodin, morphine. These are common medications that people take for anesthetics. You get a tooth pulled or you delivering a baby. Like these are common drugs, so it is very challenging, but I know, like you said, it is very innocent at first. And then it can later be neglectful, basically.
All right. So we hope we answered that question for you. The next question is, what is the appropriate age to start a discussion with a child about drugs?
I think I mentioned that last week when we talked about it. When I said something, I said, it's stage versus age. So I think any age is appropriate to talk to the children about drugs, but you have to do it in an age appropriate manner. I remember when I was a young girl, maybe in elementary school, I remember seeing the commercials about say no to drugs and, things like that. But I think now, because of the way this epidemic is going with the fentanyl, and that is not just a choice to do drugs, in that manner, is kind of being forced on our children and, is being given to them sneakily. And they're thinking they're eating candy and things like that. So I think for the younger kids is more so, just, there's no early age. Just, in their stage. Like I know I have a 5-year-old, he's about to be 6. So I constantly tell him, you don't take candy from strangers. If someone gives you candy, make sure, you run it by your mom. Or if it's, if you're in school and your friends give you candy, make sure it's okay with your teacher. You can't just take candy from anyone. So, those are the things that we kind of teach them as far as that. It's kind of hard to explain to him, my 5-year-old, what fentanyl is and all of that. So just where they are, mentally, you know what I mean, as far as developmentally, you can talk to them. And of course, as you get to the middle school children, then we'll start talking about the marijuana and, things like that, the older they get. But definitely never too early, but just, talk to them in the stage they're in developmentally.
Right. And I know, last week we said, on last week we said early and often. I think I live by that motto just because of the world that I work in and the things that I see. But early and often, like you said, Ebony, there is no harm as long as it is developmentally and age appropriate. And a while ago, we talked about just brain development, brain function, the stages of brain development and different things like that. And that's children are the most influential between the ages of 12 and 21. And so they're paying attention to you, even when you don't think they're paying attention to you. And we live in a world where social media is everything, and so just being super cautious about the things that you can't hide children away from everything. They're going to get exposed to things even when you don't want them to be exposed to them. So I always say it's best for you to create a space as a parent or a caregiver where children feel comfortable enough talking to you about any and everything, whether that's drugs, whether that's sex education, whether that's finances, whatever. Create a space where children feel comfortable and be proactive, right? You have a 5-year-old, but teaching them, hey, we don't take things from strangers. Just here in Georgia, I think this was right before the pandemic. During Halloween time, there was a family who brought in some edibles, and the classroom got it. And all the children were sick. They had to shut down the school for a little bit. And this is a real thing. And the parent apologized about it, saying, "Oh, I didn't mean to give them this. I gave them the wrong batch of Rice Krispies." Like, you know what I mean? You accidentally give a classroom the wrong batch of Rice Krispies, but then they come in and everyone's in a hospital or they're at home sick because they had edibles. So this is how easy, like, people have access to drugs, even if it's intentional or not intentional. And so I think it's super important to be cautious about the information that you are giving your children, letting them know about any and everything, and having those conversations with them early and creating a space where they feel comfortable bringing things to you.
Right.
And also, with Halloween approaching, West Virginia has put out, news about they seized like 10 tons of fentanyl at their border, the southern border. And the fentanyl looks like rainbow candy. The target are our children. They're coming for our children. Bright colors, look like Skittles. The fentanyl powder is colorful. So drug cartel are coming for our children. They're coming for our children. What we need to do as parents, we have to intervene. So we have to educate. I don't care if it's a 5 years old, 3 years old. Say no to candy. Don't give my child candy. My child is not allowed to touch candy. Do that, because they are being deliberate with their efforts to get our children. They're even making it attractive, colorful, nice, cute colors, and it's death in colors.
Right.
So yeah, we have to start very young.
Right. And then go ahead, twin. Go ahead. I'm sorry. Go ahead.
I was just gonna say, and another thing too, like the accessibility to different drugs, right? We live in an area where, CBD is legal. We live in a county where one of the counties is legal to have up to a certain amount of THC. And so if you have a child who can walk into the store and buy CBD without saying, "Hey, I can check your ID. Can I check your ID before you get this?" It's so accessible. that you have children who look more developmentally older than what chronologically they are. So if you got a child that I've seen children 15, 16, even 13, you're like, you look 18, 19, you know? So they're walking into stores being able to get things like, you know, CBD, and then they're lacing, you know, these different things with fentanyl, you know, and everyone has access to it. So it's so accessible, I think, with the world that we live in, and then trying to create those boundaries or that space or that wall where you're like, okay, no, 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 you know, like we're not going to do this. It's very challenging as a parent.
Right. So we're seeing, Michelle mentioned it so well too. We're seeing it as, I was sharing with you before we came on, that I saw this segment last week, that I forgot what state it was, but I'm thinking it was the border of Texas, where they were actually, they seized some fentanyl, and it was in Skittle bags. You know, it was in different type of bags. They were in candy bags, and they look so colorful. They actually look just like the Skittles. So parents, we're trying to put you in a position to alarm you of what's really going on, especially as the Halloween season is approaching. And you know, if you were anything like me, you want to go trick or treating, regardless of what, you know, what we got. You know, so we got to be alarmed with all of that. And it's amazing that most of our segments go back to some of the other ones we've already talked about, where we talked about how communication is the key. We got to open up a line of communication to actually get our children to trust us, and to be in a position too that we can listen. We talked about that before, where often as parents we don't listen to learn. We always listen to respond. So a lot of times we got to put ourselves in that position where we're listening to learn, and take that extra effort to get our children in that position that they can see that this discussion that we're talking about, you can easily, and just as adults, we can easily be lured into this, and it can be unintentional, you know.
Yeah. And just to kind of elaborate a little bit more on kind of what you were saying, I was working, I know a kid, right, who was in a coma due to being laced with fentanyl. And he's doing fine now, thank God. You know, he's doing well. And there was a conversation with him about, okay, like, how are you feeling? Like, do you feel comfortable enough to have conversations with your parents about drugs? And it's like, no. Had a separate conversation with the parents. Do you feel comfortable having a conversation with your son about drugs and getting into different things, and just having conversations with like peers and peer pressures and all kinds of stuff? They was like, no, shut it down immediately, rigid, strict. And so when you create a space where your children don't even feel comfortable talking to you, I think it opens the segue for them to talk to someone else or to try other things and put themselves in a position where either they can go to jail for, or they can hurt themselves or hurt someone else.
Right, right. All right, can we pause? Let's pause for station identification. You're here again with, I'm Timothy Wright. This is Mental Health Awareness. If you are watching from Facebook, again, like and share. If you're watching from YouTube, subscribe to our YouTube channel, where you can get the notification every time we go live. Again, we're here with Quintera, Ebony, and Michelle. We're talking about opioids, and we're answering questions from the last segment. So let's go into our next question. And the question is it good to do role play and help the child learn how to say no?
Absolutely.
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 You learn that way, you know, and you
Mhm.
learn that way. So you learn how your child's strength and challenges, right? because they might say, okay, I'll take the candy. You're like, no. So it's a teachable moment. You learn what things kind of trigger words, like how to get them, what others can use. You be creative, and it's good to help them be able to be confident in their no. And and understand why they're saying no. Not only confident, but understand what's the repercussions if you try this, if this happens, what can happen, the impact of it, the negative impact. So absolutely.
Right.
Anybody
For
else?
sure.
No, I definitely agree. Role play is an amazing way to kind of teach children how to say no, but also to teach them, like Michelle says, to identify certain things to look for, because sometimes they will think things are innocent, right? But just always get them into the habit again, like I said, if it makes you uncomfortable, then you say no. And even to teach them, like, it's okay, like if someone says, hey, I want to give you this candy, and you're telling them no, and they're very persistent, it's okay, it's okay, it's okay, I'll take it, but take it to your parents. You don't eat it, you know what I mean? Because we always want to keep the child safe, right? So hopefully they're never in a situation where there's no adults around that they can't go to. But kids are very creative, especially in high school and in middle school, where the supervision is not as is not as much as a child in elementary school. So it's okay to just say, okay, thank you, and take it and walk away. And you don't have to keep it. You can give it to a teacher. You can give it to your parents, just gives different scenarios. So I'm definitely big on role play because, you learn from each other. So if that's something that your child can relate to, then definitely role play. There's no wrong way to communicate with your child. The only wrong way is not communicating at all.
Absolutely.
For sure. I absolutely agree
And you
with
don't
that.
role play with just your children. You got young adults, your teenagers, young adults, 21-year-old. I was watching TikTok, and this couple, this husband and wife, they role play. So the man come up to you and asks to buy you a drink. What is your answer gonna be? Everybody role plays, right? And the wife was like, yeah. He was like, no, say no. You don't take drinks from anyone, So everybody role plays, right? It's good to know. I'm just kind of warning that people will prey on you. So he's just trying to teach a lesson. Men will prey on you, and they'll put something in your drink and give you the drink. The same thing you do with your children and your young adults.
Right.
So
definitely.
So the whole concept is to know your strength and your weaknesses. Go ahead.
For sure.
Go ahead, Quinton.
Definitely. And also there are different types of education like that you can do. Like YouTube is an amazing tool, a resource for individuals on teaching different things. Like, I always say, like I talk about YouTube a lot, but like it's a really, really cool tool to be able to share with individuals, because a lot of times you as a parent, right? Like you're like, children, you say, oh, my children don't listen to me, right? And you could be telling them the same thing that somebody else is going to tell them, but if they hear it from somebody else, it just sounds way better. Like, they're just able to take in the information. For example, Ebony and Michelle are very close. Michelle could be saying the same thing to her son that I'm about to say, but the fact that it came out of my mouth, it just sounds better, right? Because it wasn't my mom who said it. So just being able to rely on your resources and use other tools to be able to gravitate the children that you're working with, even if that means you got to find a mentor for your child outside in the community. Hey, you seem like a really cool influence in the community. I want you to hang out with my son every now and then, or I need you to hang out with my daughter. Like, because it just sounds better. Like, they're able to develop different relationships when it's coming from someone else. But it is just as important for parents to be as involved and active as someone else would be.
Absolutely.
And just to piggyback off that, be okay with you not always being the point, the one that they can open up to. That's sometimes as parents we feel like, oh, my child should be able to talk to me, and things like that. And like Quintera said, there's going to be things that my daughter talks to Michelle about that she may not talk to me about, because not that I don't open it up for her. Maybe she's just not comfortable sharing certain things, or my son might do the same thing. But just, make sure you have that community. That's why we always say, even when we talked about this before, about it takes a village, right? So just know your strengths and know that it's okay that they have someone else that they can talk to. Like, my whole thing is I just want to make sure that they're talking and someone is giving them, steering them into the right direction. So, and just because they don't feel, they want to talk to someone else doesn't make you less of a parent or not as an adequate parent. It's just, that's just the things that happen. We all done it, be okay with it. Like I always said, I know my strengths. I'm not the teacher type. I take my hats off to teachers. Like when I tried the whole homeschool thing when my son was 4, I quit day 1 before lunch because I just couldn't take it. So, that's not my strength, and it's okay, but just be okay with it.
And be open and receptive. We said this before, just like picking back off Ebony. Just because we're parents, we don't know everything. Be open. I've sat in on conversations with my friends and their daughters, and I'm the mediator. My friend and my son, godparents, I have to call them, put them on 3-way, put the speakerphone on. Can you tell your godson? And they might be like, well, Michelle, you're doing too much right now. And I was like, okay, because I had to be put in, I don't know everything. So maybe I am doing too much, but he is too. So it's okay. You have to be open as parents, right? You have to be open, you have to be receptive, you have to be willing to listen and really, really understand that these are grown little people, right? They're growing up, they're young adults, they're children, they have their own minds as well. And we want to be able to influence them in a positive way, but we have to hear too, because the generation is different. Right? It's not like they were, like I was. Their generation is different. So maybe somebody else could say it differently than how I've been saying it. And I got to be okay with that. Not prideful, just humble, and just thank God that somebody was able to speak into that child. It does take a village. So I totally agree with that.
Right. Long as the message is getting across, we ought to be cool with that. So when you were talking, I thought about the fact that when my children want to have like real conversation, for some reason they always go to their mom, and it was told like, nah, we can't go to dad, he too hard. He always he opens up with a solution, and so that's why I got that from. I said, look, you know what, I got to chill, because you never want to tear down the communication. You always want to build your communication up, that your children can talk to you. So y'all pray for me. I'm working on that one. Because I like, here's your solution, my friend.
Mm-hmm.
So we working on that. Hey, keep the communication open though. And yes, role play is definitely necessary. Let's answer this last question. And we kind of touched this in the beginning. And this person was anonymous. They didn't want no one to know. And I was like, why you don't want nobody to know? Let's just ask the question and answer it as well. What other forms does fentanyl come in, or opioids? We talked about the patch, and that
about pills,
Yeah,
powder, patch,
eye drops.
eye drops.
Mm-hmm.
So it's a
Liquid.
little bit liquid, comes in liquid form. So hard form, liquid form, powder form. That's it. That's all the forms it is: liquid, powder, and hard. So that's everything that can be fentanyl can be put in anything, because we just pills, powder.
But
yeah,
but people are being creative as well with this as I've read an article where they're actually taking the pills and pressing them into a powder and then sniff.
Wow.
And it's just like any other drug, right? That can be changed. You can change the compound of it to fit whatever. Like you think about DMX, right? He dealt with drug addiction all of his life, almost since he was 14. Someone laced his marijuana, right? I think it was cocaine at the time. And he dealt with an addiction for the rest of his life. I think he passed out for a couple of hours, came back, dealt with an addiction for the rest of his life to get that feeling. And so, but at the time, he thought he was just taking marijuana, didn't know that it was being laced with, I think, cocaine at the time. And these are the same things that happen to other people, right? Anytime you're lacing drugs, you're changing the elements of it. And so sometimes people know about it. Sometimes people don't.
Right.
And unfortunately, they do have effects on you, whether those are physically and or mentally. You
Right.
know, some of the things that we've seen from individuals who suffer with different drugs and stuff, hallucinations, auditory, visual, depression. Those are some common things that people deal with that are side effects of just drugs, you know? And there are a lot of people who have issues with opioids or have issues with fentanyl, and these celebrities, people that you see all the time, at the time of the George Floyd incident, you know, he had
Michael
opioids in his
Jackson.
system.
Yeah.
Michael Jackson, opioids in his system. Like there's so many Whitney Houston,
Yeah.
opioids. Like these are all
Mhm.
very common things that people take or may have been prescribed from their doctor. Sometimes they're broken down in different ways, but it's in their body.
Right.
I think
Even
Michael Jackson had a whole IV. They found him with had a whole IV, had the whole setup. His doctor came there to administer his drugs to him, his
and it
fentanyl to him.
also it's also opioids too. Like I don't know if you guys remember certain cough medicines they started taking off the shelf because people were using that as like a form of a drug and adding things to it. And and be careful too, like the rappers, they call it the scissor, where they're adding like what is it, like the promethazine and
Mm-hmm.
sodas and all type of candy, and it's supposed to be like this cool thing, but it's really killing people,
Called Lil Wayne to have a seizure, didn't it?
right. He had a seizure, so these things are, really dangerous. And, again, like you can find, opioids also in, like I said, cough medicine. Like, I know when, especially when, COVID first hit and, people getting these bad coughs and colds and, the doctor would prescribe the promethazine, because it's supposed to help with the cough and things like that. But that also contains an opioid,
Mm-hmm.
is, or the liquid. I remember when I had my tooth pulled, like they gave me a liquid codeine,
Yeah, that's
so
what I got. Hydrocodone cough syrup. That's what helped my cough. Yeah,
yep.
they still give that. Yeah.
Mhm.
Oh wow, wow. Y'all got me my mouth wide open because I never knew just that all this is going on. And here's the reality, though: it's not just in our metropolitan cities.
It's everywhere.
It's
It's
everywhere.
everywhere.
And it's really bad in rural parts of the country. Like
Right.
the
Let me tell
country.
you, yeah,
Ooh,
let me tell you, because even Georgia has rural parts. Like a lot of people, when they
yeah,
think about
yeah.
Georgia, they think about the metropolitan area, Atlanta, like even just around here, like, some of the things that we see, one of the counties, northern counties, I work with a lot of children up there, big on meth. Like, you know what I mean? Meth lords everywhere.
Yeah.
But like these are children, families, everyone have access to these kinds of things. And it's unfortunate. But I think that, like we've been saying before, like have these conversations often, early, create a space where your children feels heard, feels seen. And then with the holiday season coming up, just really be intentional about these type of conversations too, because you have families like, I don't know if I want my child to go trick or treating. I don't know, if I want them to participate in different things happening at school. It's not saying that they shouldn't hang out and do certain things, but maybe create a space where you do your own trunk or treat, or you do, your own Halloween bash. Maybe, have something at the house and have everybody, in your family members or your very close friends that you could trust, to bring candy over or, make different Halloween treats. I know one thing, my family and I did last year, we did the pumpkin carving. That was a new tradition for us. Like, so just kind of think outside of the box of ways that you can still celebrate the holiday, but maybe not include some of the normal things like candy and, stuff that children have access to.
Right. Right.
That's very good. That's very good.
So, y'all, we answered all the questions. I think we did it in a timely fashion. So we're going to pause here and we're going to do final words and we're going to get out of here. Ebony.
I just want to say thank you for your questions. I'm glad you guys found this topic very helpful. And remember, it's okay to, talk to your children any way that you can. It's never too early to, start these conversations and just, to kind of practice safety. So I'm glad you guys, enjoyed it.
All right, Michelle.
I'm picking back off Ebony. I think it's great that we had this talk. We're gonna continue to talk and communicate with you all. It's about to be Halloween. Check that candy out. Take it somewhere and check it out. Have fun. Make great memories, but be safe. See y'all next time.
They call her cute.
Yes. I absolutely, like I say all the time, I absolutely love this. I just always pray that this information is beneficial to you all. Definitely continue to send your questions. And I always say that this could be anyone, right? Any one of us could be in a situation where we get into the wrong candy. I love sweets, y'all. We get into with the wrong people, this or that, and so just be cautious about your surroundings. Be mindful and careful of the drugs that you do take, whether they're prescription or not, because you do have some people that are, trying to wean themselves off of different drugs, whether those are illicit drugs or not. Definitely just consult with someone. Communication is key. Mental health is important. Definitely, I'll always say stress management is everything, especially when you're talking and dealing with children who may have these concerning questions and you don't know how to answer them. So just watch how you deal and manage with your own stress, because your children are watching you. But that is all that I have to add, and thank you.
All right, parents. The season is here where we trick or treat. I agree with Michelle. Be safe. Get you some memories, but be safe. Somewhere in America, metropolitan or rural, there is someone suffering from the very thing we're talking about. And if you know someone, be intentional about getting them some help. That's as intentional as you can get. And if you do that, you're really saying that you are their friends, So we don't want to be like the commercial. This is your brain. This is your brain on drugs. Anybody that's ever seen that commercial, you got to be at least about 40 at least, where they put the egg in the skillet before it fries. This is your brain. This is your brain on drugs. We want to get people to that point where they understand the risks, knowing what's the seriousness of these drugs. So until next time, man, I love this. Hey, thank you, Michelle.
You are welcome.
Thank you, Ebony.
Thank you.
And thank you, Q.
Thank you. It's a pleasure.
And I want to do this before I leave. Today is my mother's birthday. So y'all
Happy birthday.
Happy birthday.
Happy birthday.
Dorothy Crutcher. She's a big supporter of this show, a big supporter of my ministry. Happy birthday, Mom. We love you like a fat kid love cake. We'll see you next week or whenever. Hey, y'all rest well.
Thank you.
Good night.
Good night.